my name is Dr. Julian De Silva. I'm a London-based oculofacial, cosmetic and plastic surgeon, and today I'm answering frequently asked questions. A frequently asked question that I get asked is, do I need blepharoplasty? And blepharoplasty comes from the Greek word, blephar meaning eyelid, plasty meaning to change. So literally means to change the shape of the eyelid. And most patients who come to see me are not necessarily looking for a change in the shape of the eyelid, they are looking for a rejuvenation and a natural appearance to their eyelid, to go back a few years to an appearance that they once had. And so this is quite different from changing the appearance of the eyelid. So a frequently asked question that I get asked is, do I need blepharoplasty? And on answering this question, there are a few things that we need to consider. Firstly, what are the changes in our eyelids that we are noticing? Secondly, how much do these features actually bother us? Is it something we notice every single day or not? And thirdly, what is the recovery time? How much downtime do I need before I can go back to work, my usual activities, meeting my friends, and all these attributes? So let's take these in order. So firstly, what are the characteristics that you notice with your eyelids? Well, if we first of all look at upper eyelids, the common things that people notice are hanging of the upper eyelids, a droopiness in the upper eyelids. Often this is characterized by friends or relatives noticing tiredness or asking you, are you not sleeping? Are you under stress? Because these are the connotations that are associated with changes in the eyelids. So there can be hanging, there can be excess skin, there can be swelling in the upper eyelid, which is related to fat that usually cushions your eyeball that is now coming forwards, and that is called orbital fat prolapse. And in women particularly, wearing makeup could be more of a challenge because there could be smudging of the makeup and it can be more challenging in order to do that. There's also a few other considerations that must be made, and with your upper eyelids, the position of the eyebrow, whether there is characteristic changes in the skin, laxity in the skin, the position of your lacrimal gland that creates tears, all of these different characteristics are very important. And with any kind of eyelid surgery, there are always exceptions to the rule, and with upper eyelid surgery, Asian blepharoplasty, male blepharoplasty, revision blepharoplasty, these are all unique cases that need to be considered separately in order to give you the best possible result. So now let's talk a little bit about lower eyelid surgery. So lower blepharoplasty, well, broadly the changes that people tend to notice in the lower eyelids tend to be centered around bags. And these bags are made up of fat that surrounds your eyeball, like cushions your eyeball, that is coming forward as a swelling. And these bags are often associated with facial aging, but I have many patients in their 20s and 30s who've had these bags as a result of their genetics. And the key characteristic of these is they make you look tired. So patients often tell me that friends, relatives, colleagues at work often describe these changes and ask them, are they not sleeping well? Are they under stress? Because changes around your eyelids suggest things about your general health. And you may feel absolutely fine, but these characteristic changes are giving off subconscious cues about you. So with the characteristics in the lower eyelid, there are a few important details that are relevant to the eyelid changes. Is there changes in the skin, like laxity in the skin? Are there changes in the actual eyelid? Is canthopexy or canthoplasty required? And in addition to that, is there any evidence of swelling related to festoons? And so there's a lot of detail in the eyelids that are very important to consider before having surgery, because the surgery needs to be tailored to those specific needs. So let's move on to how much these characteristics actually bother you. Now, if when you look at your face and you look at your eyelids, the changes that you notice are things that you're noticing on a day-by-day basis, then this is probably the right time to do something about it. If you're only noticing these changes occasionally, and sometimes they don't seem so much, this is probably not the right time, because the changes that we are looking at in your upper and lower eyelid, there is no non-surgical method that's going to improve these. Really, you need surgery, and this is called blepharoplasty. So in terms of the surgery, what does this involve? So in your upper eyelid, upper blepharoplasty often involves a combination of removing some excess skin, tightening of the muscle, and shaping or sculpting of the underlying fat that may be coming forwards. And that is called upper blepharoplasty. Lower blepharoplasty, which is often related to the fat coming forwards, in addition to other things like dark circles, loss of volume and fat, generally is related to removing or reshaping some of that fat. Modern day techniques are very much around fat preservation, and so it means transposing, moving the fat to where it's causing a swelling, to where actually there isn't sufficient fat. And this is the latest innovations in terms of facial aging, is that generally most of us tend to lose some volume in our face as we get older, and a proportion of that is fat. And with fat preservation techniques, we are really enhancing our natural aging process by preventing excessive loss of volume and excessive loss of fat. So with the surgical techniques, particularly in the lower eyelid, the older, more conventional way of doing the surgery was through the skin, and this would result in a scar, and there would be a healing period of weeks to months with that scar. The newer technique is completing the surgery on the inside of the eyelid, which is termed transconjunctival blepharoplasty. And that is a technique that I use for more than 90% of patients in the lower eyelid, because this avoids a scar and gives you very fast healing as a result. And there are a lot of tips, innovations, surgical techniques that can be designed around improving healing and improving recovery and giving natural looking results. So what is the recovery time with this? Well, it depends on what aspect you're looking at. In terms of social, professional, these kind of requirements, for eyelid surgery I tell most of my patients you need a minimum of 1 week off work and social commitments. Sometimes it's nicer if you have a little longer than that, like 2 weeks, particularly if you have additional procedures which may include laser resurfacing or fat transfer in order to enhance the results. But broadly speaking, it is 1 to 2 weeks. There are measures that can be taken in order to speed up the recovery process, and that involves steps to take before you actually have surgery, steps during the surgery in terms of surgical innovations and techniques, and thirdly, in terms of things that can be done after the surgery to improve healing. So, thank you for your question today. I hope you found some of this information useful, and if you'd like more information on blepharoplasty and particularly recovery with blepharoplasty, please have a look at my website. Thank you.